Hi guys, it's Dr. Heyer. I hope this video finds you well. I'm here today with a good friend of mine and colleague, Dr. Harry Kunelis. Say hi, Doc.
How you folks doing?
And the reason I'm introducing Dr. Kunelis to you is because, in my opinion, he is the best dentist in the entire southwest suburb area. And no disrespect to any of your dentists, but I can say that because I've worked closely with him on several different cases where patients were having the severe headaches, neck pain, jaw pain, what people might refer to as TMD, and I like working with him because his approach is a little different than the standard dentist, and I'm going to let him explain it himself.
Thank you for that, doctor. Currently we still have the capacity to treat our traditional drill and fill dentistry and take care of any tooth decay and things of that nature and gum disease. But we also try to take it a level further, one step higher, and start addressing the further relationship that the lower jaw has in relation to the head, in relation to the neck, in relation to other parts of the body. Actually, a theory that's not widely accepted by the medical community, but over the last couple hundred years has allowed for some very, very successful management and in most cases complete alleviation of head, neck, and jaw pain.
Okay, so what we were talking about earlier before we started the video is that there's kind of the old school chiropractors and dentists that look at things very statically, and then there's kind of the new school that look at things dynamically. And the best analogy I can use is that if you've been in the office and we've looked at your x-rays, that's a static approach. That's looking at the vertebrae and the spine in a two-dimensional point of view. That's not how the body really works. We look at muscle function, we look at muscle tension, muscle strength, and we look at it from a dynamic point of view. And what you're saying is that the old school dentists kind of look at the jaw as a static thing, and you're looking at it as more of a dynamic thing where everything works together from the head to the spine all the way down to the feet.
Absolutely. The static concepts or the traditional concepts are very important in identifying many aspects of what we consider to be the functional concepts. In reality, when we hold our arm out in a static position or when we hold it in this completely static position, those are only rare instances that we're in that position. Normally we're in a state of function, and the same thing is true for the jaw. And most of traditional dentistry has allowed for a concise description of what the static position is. However, it hasn't tested that position relative to the other movements of the body, which is, in my opinion, the most important. In other words, if you have a position that is correct by the dentist standard, if it has an increased range of motion in the head or in the cervical spine, and there is another position, a dental position that is more functional, that is breaking the rules of the static position, that may in fact promote much easier head and neck movement or increased range of motion. That's the neuromuscular dentistry approach that has been coined the term neuromuscular dentistry to explain this approach where we're looking at the lower jaw in relationship to the head and in relationship to the neck, and how that allows for increased range of motion in all these structures.
So what you're saying is the position of the jaw can affect the position of everything else in the spine. And I can speak personally on that. I attended a course, an applied kinesiology course, where they actually discussed a research project that was put on by a dentist and co-sponsored by a chiropractic college. And what he was doing, this dentist was correcting the misalignment of the jaw and actually correcting scoliotic curves in patients. Now, the disparaging thing is that the college got a little offended and shut the project down, but I guess what it's saying is it confirms that everything works together. And that's why we work together, because we've gotten patients who have been to standard chiropractors, the standard dentist, they've tried meds, they've even been told they need surgery, and because we work together with our, shall we say, progressive approaches, we've actually been able to help those people alleviate their pain. And we can't possibly go into all the details in a short video, and that's why we'd like to invite you to a presentation on Wednesday, December 9th at 7 o'clock. That's Wednesday, December 9th, 7 o'clock at my office, where we'll go over a little bit more detail on what we do and probably take about 30 or 40 minutes, and then hey, it gives you or a friend or a family member who maybe you've been trying to get into the office an opportunity to ask us questions. So if you know somebody who's having headaches and neck pain and jaw pain, invite them, and it's no obligation, it's free, and we'll see you there. Did we miss anything?
I don't think so.
All
Can't
right.
wait for the date.
We'll see you there, guys. Thanks.
Thank you.